Cool. All right. So I just wanted to do this, with one of my really good friends and now patient, actually, Giselle. And she's just going to talk a little bit about things that we've been doing together and kind of her experience with now becoming a new mom, and kind of how this postpartum phase has been going. So Giselle, why don't you just like introduce yourself and maybe how we know each other.
Sure, yeah. So, yeah, Shannon, you and I went to college together back in Syracuse. So that's where we met. Oh my God, it's years ago now.
Yeah.
But, and so now we're both, 30, and I'm a new mom. So my daughter is just about 7 months old. And, I knew your field was chiropractic, but I think I really reached out to you when I was having like some neck and shoulder just tightness and pain and maybe soreness waking up after sleeping.
Yeah.
And I know it pertains to breastfeeding and kind of like a hunched position that a lot of new moms find is their experience the first few months in their child's life. So I think that was like the first thing I reached out to you about.
Yeah.
But I also remember when you came to visit and see Natalie when she was like 1 month old.
Yeah, that's right.
And we talked about C-sections a little bit, and you mentioned scar tissue mobilization, and I was like, what is that? I don't know why my doctor doesn't talk about that, but I mean, that's kind of how we started like a conversation about getting back into things after surgery. So.
Yeah, absolutely. And how would you say, I guess overall, like your whole birth experience, like what do you think that was like?
Yeah, so because of my daughter's breech position, it was a planned C-section.
Yeah.
At the beginning of my pregnancy, that was not my plan. That was not my hope for it. But after I came to kind of accept like where that was headed, that's C-section was where we were at, and so I accepted that. And I think like my overall birth experience was excellent. Props to NYU Winthrop in Mineola, New York. Like I had a great experience. I think my experience is that was my first major surgery.
Yeah.
And I think a lot of other moms having their first child by C-section probably are going through the same experience as their first major surgery.
Yeah.
And so you don't really know what to expect, how you're going to feel afterwards. Yeah, you have this beautiful baby and you're so excited, but then there's all these other things going on in your body, and some of them you're just not sure if they're normal, or and you want to kind of feel like you can chase after your kids in a year and do the normal things that you used to do, like biking and whatever fitness or just normal things you were doing. So
absolutely.
Process.
Yeah, no, for sure. And I can imagine too, like as you're going through like your pregnancy too, I mean, you go to your doctor, but it's like, do you really get the sense that, what you're experiencing is like normal, or are there like things that, maybe you're just maybe not afraid to bring up, but just questions and concerns that you might have, especially maybe even like postpartum, like especially after a C-section, like how much guidance do you feel like you got from, I guess, like maybe the other providers you saw?
Yeah, I mean, I do think my providers were excellent. But I still think there's some lack of information when it comes to C-section and postpartum recovery. They want to make sure you're not having problems with your scar area. They want to make sure you're not having an infection, kind of like those major things that could take a bad turn. But I didn't know anything about scar tissue mobilization. And of course, when you think about major surgery, like they're cutting through a lot of muscle, a lot of tissue down there, and it doesn't happen overnight that you're just zip back up and moving fast. Like you're moving slow. And I think 1 and 2 months postpartum, I was walking slower than when I was 39 weeks pregnant.
Yeah.
I mean, so that's eye-opening.
Yeah, absolutely. And now would you say working with me and kind of, yeah, talking about this stuff and learning about how, I mean, just like your core works in general with like your diaphragm and your pelvic floor and like all the muscles surrounding, do you feel like, yeah, you have a better understanding of like how important like that kind of area is in terms of like body movement and, you know, creating stability, so on and so forth?
Absolutely. So yeah, so you and I think we've been meeting pretty much weekly for about 3 months.
Yeah, I think so.
And definitely your guidance has been so valuable to me. And I've realized like the core, it really is like the core is the perfect word for your trunk area, because it is the middle of your body. It's holding you up. It's helping you move. It's stabilizing you.
Right.
And definitely working with you through core mobility and stabilization and functional movements has really, yeah, I mean, helped that part of my body like wake back up. I mean,
Yeah.
pregnancy, I did not six-pack abs, but I still feel like I had some level of fitness in the average realm of a 30-year-old woman. And so I think, you know, starting to build that back, and my posture has improved. Like, sex is less painful than it was 3 months postpartum. So that is, I mean, I didn't realize that was going to be a huge benefit of core work. But I mean, it really was like amazing. I was like, yes, like it doesn't hurt anymore.
Yeah, I'm wondering even like how much do women know about like that experience, like postpartum? Like, should they, like, did their doctor actually tell them, like, you know, you might have pain after sex, or like, you know, like these little things that you might not really think so much about?
No, I mean, I thought with a C-section, I was like, oh, perfect. I'm not having a vaginal birth. I'm not going to have any pain.
Yeah.
And I was amazed that I did. And so, yeah, I honestly expected to have no pain.
Right. Yeah.
No one warned me about that.
Right. Yeah, definitely. I think now that C-sections are just so common, I think it's just kind of like, maybe we have it in our mindset that it's kind of this in and out thing, you know, like now it's, oh yeah, you can schedule your C-section, like you can schedule for when like you want your baby to be born. Which, I mean, if there's, you know, a specific, like need for that, like breach, and they're, you know, they're worried about the safety of like the mom or the baby, like that's what they're there for, which I think is obviously a really great thing. But I think, unfortunately, maybe in this day and age that there just isn't so much of education and kind of, you know, like warning, you know, like these are the things that can still happen, you know, post C-section. But no, I think, like, thank you for actually bringing that up, because I know, even when we were like discussing, you're like, I don't know if this is like connected, or, you know, if this is something that I should be experiencing, but you're like, yeah, like I've had less pain after sex. And I'm like, yeah, absolutely. It's all connected.
Yeah, like everything in there is just connected. And going back to like scar tissue mobilization, you mentioned it to me once, and so I did like a little more independent research on that, and you shared some like helpful tips and things on like working through those techniques a little bit. And I mean, you just, again, if you've never had major surgery, and I mean, maybe even people that have had major surgery don't get a lot of guidance on how to care for their completely healed scar. You know, and making sure it's not tugging and can kind of move independently from the layers below the visible scar. I feel like I already know so much more about that.
It's awesome. So great.
And one other thing I just wanted to say was, like, we started working, we didn't get the chance to do any physical in-person sessions, you and I, so from the beginning we started virtual.
All virtual.
And from the first time we did that virtually, I was like amazed, like, you know, even virtually, you can see the tilt of my pelvis. You can give me little corrections and, you know, technique modifications because you can see me so clearly. And
Yeah.
like I've just been amazed with your attention and like how well it's gone virtually. I mean, yeah, like I think we've been having a great time of it. Of course, in person would be twice or three times as good, but
Right.
I'm been amazed by that.
Yeah. Oh,
So
thank
thank you for your
you.
attention.
That means a lot. Yeah. I think with all the, stuff going on, it's definitely forced me to, yeah, kind of practice another skill set a little bit more, which is definitely more of the visual. Because I think, yeah, especially as a chiropractor, we're very used to just being like strictly hands-on and kind of just like, okay, like I know what I'm doing. But it's been interesting to, yeah, kind of take a step back from that and be a little bit more cognizant of like what's going on in front of you and actually watching people move, because I think you can get still a lot of information just from like watching people. Yeah, it's been fun. It's definitely been an experience. And I think also with that, I think, yeah, hopefully you and maybe my other patients I've worked with have realized like how much you can still get done
Yes.
without kind of the, the touch or the massage or like, that kind of in-person kind of hands-on work. I think you can still get a lot of benefit from just movement and, yeah, doing things kind of on your own. And I think that's actually even more so empowering because like you're doing it yourself versus depending on somebody else to like do it for you.
Yes.
Yeah, for sure. Would you say you looking back, I guess, at this, like, were there certain things you wish, I guess we kind of talked about that, but you wish you knew like beforehand, like going into a C-section, like knowing what you know now, do you think you would have tried other things in terms of maybe like trying to get like baby to flip, or like I don't know if you went through any of that kind of stuff to like kind of prevent maybe a C-section?
Yeah, I guess when it came to Natalie being in the breech position, I tried all the home remedies. So I feel I tried everything at home without going to an acupuncturist or a chiropractor.
Gotcha.
I did go in for an external cephalic version to try to have
Yeah.
doctors help
Yeah.
spin her, and that was unsuccessful. So kind of, yeah, my husband and I went to that. Our mindset was, okay, this is like our last try, and this is the point that we're going to accept that the C-section is going to happen.
Yeah.
So yeah, when that was unsuccessful, that's kind of where we drew the line for us to say,
Right.
okay, we're gonna like stop obsessing over it a little bit and
Yeah.
accept that it's gonna be a C-section.
Mhm.
But I do feel like there's a lot of information out there, and there could be more coming from doctors about it.
Mhm.
Although I will say, my doctor did say when Natalie was breech around 30 weeks, my doctor kind of rolled her eyes like, good luck getting her flipped, because sometimes it can be there's can be stubborn in there. So
Yeah. Yeah.
and I was like, oh, I can do this. And so I was, thinking about my doctor later, and like maybe she knew all along that it is sometimes challenging, but I
Yeah.
know there's methods out there, and I know that especially ECV and other methods can have like a 50% success rate is what I've read. So,
Yeah.
it's kind of a toss up, but
Right. Right. No, absolutely. For sure. Yeah. Um, what about now going forward? Do you have any, I guess, like long-term goals with where you want to be like body wise? I don't know if there's, you want to get back into a sport again or, something you have like a goal for yourself?
yeah, I think right now my goal is to just kind of commit myself a little more to self-care. And I think, again, like being a new mom, you spend 95% of your time and your like brain power thinking about your child. And
Yeah.
so I think right now I'm just spending a lot of time making time with you. I look forward to that for real, because it's like
Aw.
my weekly time that I'm like taking care of myself.
Exactly. Yeah.
Um, and so definitely trying to spend time like committing to myself. Now looking like a little bit ahead, I do want to get back into running, and I've done like a little bit of running, and I will say I've had much less, I guess, like tugging and tightness of my skin in that lower area. So I feel more mobile, like more
Right.
like able to take a nice long stride
Yeah.
when I run.
Removing.
So I definitely want to, and I kind of have my eyes set on maybe a half marathon this year, because I ran a few maybe 5 years ago. So I'm like, okay, like that would be a good goal, like to get back to that kind of a distance. Maybe it'll happen in 2020, maybe next year. But yeah, and I mean, the other thing would maybe just be getting back to a little bit more fit than I was pre-pregnancy for Natalie. So like before we have our second kid, I want to be just like that much fitter
Yeah.
and
Yeah.
like ready for number two. That's kind of my goals now.
You guys already thinking about number 2?
Yes and no. I mean,
Yeah.
Natalie's certainly a handful, but I think it's nice to have like siblings that are somewhat close in age. So
Definitely. Yeah. Yeah, because
not too soon, but
right. Yeah, because you're the oldest, right?
I'm the oldest. Yeah.
How far are you between Terry and Hope?
My brother is 2 years younger, and
Okay.
then my sister is 8 years younger than me.
Oh, that's right. She is. Oh my God, I totally forgot about that. Yeah, 'cause she's.
Yeah.
Wow. Okay.
And so when I was in high school,
Yeah.
she was, less than 10. So it felt like a big gap. Now it feels like so much less because she's in her 20s. And so,
Yeah.
like, last year we were in the same decade of age. So
Right. Yeah.
it feels like we're at a similar maturity level now. But
Yeah.
yeah, I mean, yeah, we've talked about it, and we'll see how next year takes us. So
Yeah. Absolutely. Definitely. But I'd
I
say,
will say,
yeah.
no, go ahead.
Oh, no, I was gonna say, I mean, if and when you do come to that point, I think you're just gonna be that much more prepared, and that much more, yeah, resilient. So I think your second pregnancy, you should be a lot, I don't know, you're just more prepared in general, a little bit more educated. I think it seems like with each pregnancy, like, it's like you learn a little bit more. Yeah, it's like now you've done the first thing, and I think it's always like the unknown. Like, I've never done this before. I don't know what's going on. Like, is this normal? Is this not normal? And now you're kind of like, okay, I know what to do. But I think, yeah, what we've been doing, I think will just make you that much more prepared, which is great.
Yeah, I totally agree. And I think, like I said, I had a great C-section experience, and if another child, meant that I had another C-section, I would be okay with that because my experience was that great.
Yeah.
But at the same time, I am hoping to go for a VBAC. So yeah, I mean, I think, yeah, everything we're working on together hopefully can help me get to that point where,
Right.
between myself and doctors, and like we're making the right choices, and hopefully
Right.
I can try for a VBAC. So we'll see.
Yeah. Yeah, absolutely. Definitely. Well, thank you again for doing this. I think hopefully people out there kind of maybe get a little bit of more of an understanding about maybe what to expect with a C-section, and maybe learn something that they didn't know before. Are there any like last minute, I don't know, like comments or things you want to put out there?
Well, thanks for inviting me to talk, but I would just say, like, I'm definitely an information seeker. So it's just my nature to like research things
Yeah.
so much before I dive into something. So I would just
Right.
encourage women, even if you're not thinking about kids yet, or if you're
Right.
not a new mom, and even if you are, I mean, just seek the knowledge and ask the questions.
Mm-hmm.
Expect a lot from your doctors, and just
Yeah.
seek other health professionals like yourself, Shannon, that, can help you figure out, what's normal, what's not, and reach goals that you want to reach, and
Yeah.
help your body wake up and feel like yourself.
Yeah, absolutely. Yeah, that's so important. Yeah, I feel like, and even I would say not even just like my pregnant patients, but I've had other patients too where, they've gone to maybe other doctors beforehand, and I don't want to, I don't know, bash, I guess, other
No.
doctors, but I get sometimes the sense that like patients feel like they're not being taken seriously, or they're spending so little time with them that they feel like they can't get all the questions out that they want to and have that discussion, because they feel like, yeah, especially with just the healthcare madness, it's like I feel like doctors don't spend as much time with people as maybe they should. So yeah, I would guess I would just urge people, like, if you feel like you're going to a provider that like, isn't giving you the time of day, or you feel like you're really not getting kind of that attention, like I would definitely just urge you to go seek somebody else that is going to give you the time of day, because I just think that's just so important. I think people deserve more, and people deserve, yeah, a higher quality of care, than from maybe some of the, I guess, experiences I've been hearing about. So
Yeah, I would echo exactly what you're saying.
yeah,
We've talked about it before, though. I think it's a product of the healthcare system,
yeah,
kind of
absolutely.
pressuring doctors to be in and out, patient, in and out, in and out. And
Yeah,
but I agree with you. Yeah, like advocate for yourself
yeah,
and
absolutely.
um, find the people that you want to work with that are gonna listen to you and
Yeah,
hear your concerns.
yeah, definitely. And
I
yeah,
know that's gonna be a problem for me. Not a problem. It's gonna be something I'm looking for, is to find a doctor that's gonna support me in a VBAC. So it may take me a few times to find that person that's gonna say, yes, I will support you in this.
right.
And
Yeah, absolutely. Yeah. Yeah, I think there's just so much information out there too that sometimes it does get overwhelming. It's like, what, like, yeah, so you can always find information that are going to support both sides, but I think it's just important to, think of the pros and cons, and then come to a decision, that you feel is the best thing for you. So that, you don't feel pressured going one way or another, whether it's a C-section or, vaginal birth. Yeah, it's not like one is good, one is bad. I don't really like saying those words. It's like, what's best for you. And I think, yeah, trying to find a provider that isn't pushing one way or another, isn't forcing you to do one thing or another that you're not comfortable with. So yeah, it's like you're your own best advocate. So it's like, don't forget that.
perfect way to put it.
Absolutely. Cool. Well, thank you again. I love this. This is so great. Thank you so much. And yeah, I hope that if anybody's watching this, that you learned something today. So
Yeah, I hope so.
yeah,
And thanks again for having me.
absolutely. Awesome. Thank you, Giselle.
You are welcome.